All right, so day five. Couple small updates. I stopped taking all the pain meds on day three, so that's different. Um, Definitely feel that a little bit in my shoulder. So I just hate the way the pain meds make me feel. That oxycodone is strong. So um, it does make the pain go away, that's for sure, and it makes it a lot easier to sleep. So I am suffering a bit from that front because I just don't fall asleep for sure. I mean, you get this sling. It's just that's your buddy for a long time. It's really that's going to be the biggest challenge in this first 6 weeks. Getting in a comfortable position to sleep, that's difficult. Every night that I go to bed, or the last couple nights, it's only been five, but the last two nights without the pain meds, no matter what position I started in, I kind of ended up in the same position where the bed is inclined and I'm trying to put pillows underneath here to alleviate some pressure on on my elbow or on my arm. Uh, I tried kind of leaning back more, but then my arm is up in the air like this, and then the hand starts to go to sleep, and then that wakes me up. So it's not much. It's not good sleep. It's really pretty awful sleep. The pain though is it's not terrible. It's there. It's very present. So maybe sleeping through that is a little bit harder. And hopefully over the next few days it keeps getting better as quickly as possible. But saw the doctor. Went to my follow up yesterday morning. He took the bandage off, so um, I have that scar there, or it's a pretty big line. But anyway, it's I guess that'll fade with some time. It'll probably always be there for sure. Just because I'm not young, I'm old, and doing this surgery. But again, um, maybe some other suggestions that people don't talk about when you're taking these pain meds. Definitely take your laxatives and stools, or your laxatives and stool softeners. It's tough to go to the restroom when you're on so much pain medicine, you have the anesthesia, and then all of a sudden that's going to add to the discomfort. So, you know, if you do get off the pain meds, it's a clearer mind. I have a clearer head, but you're going to deal with a little bit more pain, which the ice can help a lot. But you're not going to sleep with ice on you. So it's it's kind of a balancing act in what you would rather deal with. But even with the pain meds, it's not like I was sleeping great, but I could fall asleep for longer periods of time. And I never had a hard time sleeping before. So, so I think, some of these lessons so far is that the places you go to when you're in the middle of the night, you're tossing and turning, you're only sleeping for an hour, then you wake up, maybe fall asleep a couple hours later for an hour, then you wake up. You're really going to travel to places in your mind where you're going to wonder, was this the right choice? Are you dealing with pain because you had to, or just because you made a bad choice? So you better have a good choice for doing it. That's what I think, because I'm already convinced, even though I'm really convinced that it's the right choice for me, because I have clicking. I didn't have pain anymore in my shoulder, but and I did that in the first video. But I had a lot of clicking, and if I'm going to be active in other sports, I know that those problems are never going to go away, and it's going to be weak even when I was going to lift. And getting it stronger, there's always just more risk. So I was hoping to stabilize it better with the surgery, and hopes to be able to participate. And even in that year I gave it, the doctor, what he said was there was already a pretty gnarly abscess on the end of the clavicle, which can cause arthritis later on. So he shaved that little bit off the end to make more space in the joint for me. Hopefully that's a good thing. I'm sure he wouldn't have done it if he didn't think that was necessary. But anyway, it's back to the point where you know it's not going to be an easy 6 weeks with this sling. It's just not going to be. I mean, this thing is kind of tight on your neck. It's just not well designed. I don't know why they make this like this. It seems like there's a better way to secure your arm without moving the shoulder to your body other than just this cumbersome sling. But I don't know. I'm not designing medical devices. So you will question yourself, and you better have the right answer. Otherwise you might start going into some bad spaces. Some of the other reasons why I decided as well, not just my physical feeling about it, but I have two other people on my soccer team who went through this same injury, had the surgery, and both were just undeniably just saying this was the best decision for them. Like, their shoulders are really good now. One guy's my age, maybe a little bit older. The other guy's a couple years younger. And they had it a while ago, but still, they were very happy that they did the surgery. So that helped convince me that, there's a likelihood, if it's done right, that it can improve quite a bit. It was already pretty bad. So for me, I feel like, it's never going to be normal. But my shoulder was never going to be normal after I injured it. So this is hopefully a better normal, better new normal. So if I had a grade 3, man, I don't know. I've seen too many videos of people were conservative with their treatments, and it looks okay. I mean, my neighbor, like I said in the first video, my neighbor across the street, grade 3, I wouldn't have done this surgery, if that was it. But he was lifting and working out not very long after the injury, maybe 6 weeks after it. There was zero chance I could do that 6 weeks after. It was several months before I could even start to work out, just after I did all that PT just to get my mobility back. So it was much more severe in the damage, seemingly so, or he's just extremely, extremely tough. But I don't think so. I think it's just, if you have a grade 3, I would really, really. I mean, what's hard to anticipate is they cut in. It's a pretty long cut. This is longer than I thought it was going to be. And there's swelling and damage that it's pretty traumatic to the other tissue that's there, just from them cutting through all that muscle and sewing it up. And I mean, I think it's going to be pretty numb there for quite some time, and probably on this incision for maybe forever. So, they're not just stabilizing a joint, but there's a lot of other possible repercussions. And I don't know. I hope I don't get scar tissue in the wrong places, and how do I dictate that? I just ate a huge bowl of salad. I don't know. Hopefully that helps. But I have no idea. So I'm trying my hardest to do the right things, to not move this much, keep my arm in a sling outside of just setting it down, bending at the elbow, just straight. The things that I'm allowed to do, that's it. And even when I have PT scheduled for next Friday, the doctor said don't go to it until after our 3-week follow-up, which is March 21st. So it's 3 weeks away, for most of 3 weeks anyway, a little under 3 weeks at this point. But still, that's a long ways away. So I have to push the PT out. He said less is more now. So I'm going to try to respect that completely. I don't want to stretch that tendon and make that joint loose. Otherwise, the surgery all this that I'm going to go through would not be for the end goal. I would not have a chance at meeting the goal that I want. So anyway, I don't know if there's a way to prepare for the challenges you're going to face. It's just going to be a few weeks of, very tough mental places you're going to go to. I'm anticipating more of those. Maybe save some David Goggins motivational videos. I don't know. He's a master of the dark space. So I'll reiterate it. If you're going to do the surgery, it's probably good for a number of people, obviously. And I'm still convinced that it's the right thing. But even with convincing myself and doing all the work I did to read and talk to everybody and the doctors and everything like that, you will still question it. So even with that conviction, you still wonder, could I have done it without it? So I think answering that question with all certainty in terms of giving yourself a chance to recover, like a year, year and a half to recover. I mean, if you're out of the 3 weeks of the injury, it doesn't matter if you wait that long. Um, you know, so I would do that. I lasted a year, and I knew it was not going to get better. So anyway, that's day 5. It's I think overall throughout the day, it's been feeling a little bit better. I probably should give those updates. I'll do more ice, more of those cold packs that I have on my shoulder, and hopefully this pain over the next couple days, the stiffness I do feel, hopefully that'll go away, and maybe that'll make sleeping a lot easier. I don't know, we'll see. But I'm prepared for some tough nights of sleep ahead. So all right, stay tuned. I will update this maybe at the end of the week. After I'll give this next another couple days, 4 or 5 days. I'll try to get back to this maybe on Sunday. So all right, good luck to everybody who's going through it.